I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe Esposito here. So glad you can be with us today. By the way, we live stream a lot of our shows. In fact, all our shows we live stream one way or another. So if you're not doing it yet, this is your homework assignment. Okay, this is your salary. This is your cover charge to get into our lectures from now on. Follow us on Facebook, Instagram, and YouTube. My handle is @ Dr. Joe Esposito, DrJoeEsposito. If you're not doing it, we're going to send a puppy to your house to live with you and give it caffeine. So that's going to be what we're going to do to you if you don't follow us, because I need your help. We have the more people that follow us, of course, then we can spread the word out. So we need your help to do that at Dr. Joe Esposito, Facebook, Instagram, and YouTube. And then if you live stream with us, you get to see my pretty face, which you may not want to do, but we need you to follow us. So do that. So what we're talking about now, home remedies that are backed by science, because there's a lot of things out there in the world that are medical. And almost every day, I'm going to say every day, somebody comes into our offices, and I've been, again, doing this for 37 years. I've missed a half a day of work in 37 years. Patients come in, and they say, Dr. Joe, I don't want to take medicine. Now, I don't want you to stop taking your medicine until you're well enough to come off your medicine. I am not against medicine. I'm not against surgery. I'm not against injections. I'm against unnecessary use of these things. So if you have a health issue, sometimes we need medicine. If you're a type 1 diabetic, guess what? You need medicine. If you've had your thyroid removed, you need medicine. I'm not against that, but let's do everything we can to keep you as healthy as possible. And a lot of the home remedies we're going to talk about may now substitute for some of the things you're doing. But again, don't come off the medicine until you're well enough that you don't need the medicine. That's always my approach. So chances are you've used some type of home remedy at some point in your life. Herbal teas for cold, essential oils might help your headaches. Supplements, of course, Dr. Joe's Super Greens, Dr. Joe's Essential Source, nitric oxide, B-complex, omega-3 fatty acids, vitamin D. So these would be home remedies that, of course, with the supplements we have on our website, drjoe.com, these are the ones I take. So when I go to a restaurant, I say, hey, what would you order? And the waiter says, well, my favorite thing is this. And 99% of the time, I'm thrilled because the waiter's going to give it to me straight. I'm giving it to you straight. These are the supplements I personally take every single day. And there's no reason why you shouldn't either, certainly some of them, but I take almost all of them actually, because this is what most people need. So with home remedies, these are the things that many times I do, and I want you to consider using them as well. Maybe your grandmother taught you something. I know my German grandmother, she used to make a lot of split pea soup, lentil soups, and when she would, right before she served it, she'd put in some apple cider vinegar. And I remember saying to her as a child, why do you put apple cider vinegar in the soup? And she said, I don't know. We always did. Back in Germany, this is how we did it. So I enjoyed that. Just thinking about it, I can taste my grandmother's split pea soup. And so as time went on, of course, I researched everything. And I found out that apple cider vinegar can actually stimulate your digestive enzymes, and it can prevent some of the gas from being produced when you're eating beans like split peas and lentils. And it was easier to digest. So she didn't know why she used the apple cider vinegar. She just knew how to do it. Now science has proven grandma right. So a lot of things we're going to talk about today are grandma was right, because she knew what she was doing. She didn't know why. She just knew how. So recent decades, science have been asking the same questions I have, and they came up with a lot of these old wives' tales that were actually true. So first one, turmeric for pain and inflammation. Now we have on the website, drjoe.com, we have a supplement, Dr. Joe's Turmeric. Take it every day. Most people have heard of it by now, primarily in South Asia. It's part of Ayurvedic medicine. Ayurveda is from India, and it's the study of herbs as medicine, actually lifestyle as medicine. But Ayurvedic medicine, it's been used for a long time, about 4,000 years as far as we know. So when it comes to proven medicinal purposes, they call it the golden spice, is great. And one of the things it's really good for is pain and inflammation. Several studies have found that curcumin, which is the active ingredient in turmeric, is the wow factor. In one study, people with arthritis pain noted that their pain levels were more reduced after taking 500 milligrams of curcumin than taking 50 milligrams of an anti-inflammatory drug. But here's the thing, it takes time to build up the level. So if I have a headache and I take an acetaminophen or two or whatever it is, chances are I'm going to see results in about a half hour, 45 minutes. With turmeric, it takes a while. So you really want to just make it part of your supplement protocol every day. Other studies backed up this claim that it worked so well. Turmeric extract is as effective as ibuprofen for treating pain in patients with knee osteoarthritis. Now, if you have arthritis, you want to come see us and consider maybe PRP. PRP, dollar for dollar, is the cheapest thing you can do to help get the natural growth back into the knee. Now, it's not going to grow back like it did when you were 16, but it can stimulate natural growth in arthritic joints, especially knees, shoulders, spine. So you might want to consider that. In fact, it's on the website, drjoe.com. Go under services. It's right on the top. Just hover over that and drop down to PRP, and it gives you an explanation as to what it is. Relatively inexpensive for what you're getting, and if we can save people from surgery, which a lot of times we do, it's certainly worth it. So you don't want to grind your turmeric. First of all, it stains everything. The amount of curcumin in turmeric is about 3%, meaning you're going to have to take a lot of curcumin to get relief if you're grinding it. So in supplement form, it's much better. I suggest about 2 to 5 grams of the spice will give you benefits. Some studies show you can add a little black pepper to it. The pepperine activates the turmeric. Other studies show it doesn't do anything. It's not going to hurt to put a little black pepper in with your turmeric. It's about the long game when it comes to turmeric. If you're taking turmeric every day, you should notice benefits in about 4 to 8 weeks. So once again, you're not going to take and go, oop, my pain is gone. It's something that's going to build up in your body over time. There have also been some studies relating to, not proving, but relating to helping people with cancer, antioxidants, anti-aging. So there's a lot of benefits to taking the turmeric in a supplement form. And again, it's on the website, drjoe.com. It's one I take every day. You could also, if you wanted to, I guess, open up the capsules and make turmeric tea. And in fact, we posted that not long ago, a turmeric tea, didn't we, Garrett?
Yep.
Okay.
It's on Facebook and Instagram.
Okay, so if you look on our Facebook and Instagram pages, you can find a recipe. It's real simple. I love it in the winter. It's spectacular. But this is why you want to follow us on Facebook and Instagram. We post every single day. Sometimes it's health tips. Sometimes it's me doing recipes. Sometimes it's just a little fun fact. But you want to follow us on Facebook and Instagram at Dr. Joe Esposito, and you too would get information like how to make turmeric tea. Very simple. Another thing, again, as a chiropractor, and I'm board certified in pain management, and I'm board certified in orthopedics, and I'm double board certified in nutrition, so got a pretty good background in pain management. Turmeric is great. Of course, chiropractic is the most effective, least expensive treatment for back pain. So if you have neck pain, back pain, shoulder pain, knee pain, hip pain, and really any type of pain issue, you might want to consider coming to us first. Or even if you've been other routes, come see us, and let's see if we can get to the cause of your problem and not just treat the symptom. And that's why patients line up some days to get in our offices, because we try to get to the cause of the problem and not just treat the symptoms. And my doctors, I feel, are some of the best doctors in the world, in my opinion. We have, again, offices in Marietta, Duluth, Stockbridge, and West Cobb. All the doctors that work for us are handpicked by me. They're trained by me, and they're my personal doctor. If I don't trust them taking care of me, I don't trust them taking care of you. So you are in amazing hands, in my opinion, when you come into our offices. And so you can feel safe going to any of our offices, to any of our doctors. And what I tell the patients is try different doctors. See which ones you like. You may not like the way Dr., Cat adjusts, but you like the way Dr. Amy adjusts, or vice versa. So we're more than happy to let you try out our different doctors and see. And the nice part about our offices is all the doctors are there available to do a consultation on your case. So if we have a tough case, we have doctor meetings all the time. We may sit down and say, all right, what will we do for Garrett? Garrett comes in, he's got this weird condition. What are we going to do for him? Well, this is what I learned about this. Well, let me give you my input. So you have like a team of doctors working on every case for you. So it's really neat, and I like it too, because I'm a patient there too. I'm not just a client, I'm the president. Well, I'm not just the clinic director. Well, Dr. Amy's the clinic director, but I'm also a patient. And so we want to try to get you well and keep you well the best we can. We work on nutrition, the spine, the digestive system. We have our medical department. If we have to give injections for pain, we can do that. Medications, hormone checking, we can balance hormones many times. And of course, the flagship, of course, is the PRP. But if you want to look at our services, just go to drjoe.com. On the top, it says services. Hover over that, and then you can go down and look at each one of our services. Everything from erectile dysfunction, hair growth, digestive issues, pain management. We're pretty good at it. We truly are a wellness center. We try to make it a one-stop shop. So another thing that works, drjoe.com. You can book the appointment right online, by the way, if you want to, or call us. Chili peppers. The active component in chili peppers has long been around as folk medicine and is used for many different things. Capsaicin is a topical ingredient for pain management. Capsaicin is the thing that makes the pepper hot. It works by causing the area of the skin to get hot before eventually turning numb. You can get prescription capsaicin packages now with very high levels on it. But when you have sore muscles or generalized body aches that won't leave you alone, you can try taking some hot peppers. Here's an easy way to make it. 1 cup coconut oil, 3 tablespoons of cayenne pepper, and a cup of coconut oil. Melt the coconut oil, add the pepper, let it simmer for about 5 minutes. Once it firms up, you can have your own capsaicin cream. So just get some ground red pepper, 3 tablespoons, a cup of coconut oil, simmer it for about 5 minutes, and you got your own capsaicin cream. How easy is that? We also have we'll have it again starting this week, actually, because it's been gone for a while, but luckily we have it back, our CBD cream. Now, the CBD cream, I love it. It works so well because CBD, if you don't know what that is, it's cannabinoids that are found in a lot of different plants. Hemp is the one we use. Excuse me. And in hemp, the cannabinoids, we put it in a cream and a base that can penetrate into the skin, and you can rub on the CBD cream, and it works wonders as well. So that should be on the website hopefully this week as well. Again, it was out for a while, and I'm real picky about who I use in my manufacturer, so I want to make sure we're getting the best products available. Now, if you want to get really fancy, you can whip the coconut oil with a hand mixer. It makes it light and fluffy, but again, you could just take it and rub it on if you want to. Coconut oil, remember, will get firm or harden up at, I think it's 76 degrees, somewhere around in the 70s. So that's why if you have coconut oil in the winter, it's hard, in the summer it's liquid. It's just because of the temperature. That's all it is, and it's just how that works. Ginger, I take ginger tea every single day in the winter. What I do, it's how I start my day. I wake up, I take my supplements, my Super Greens, my essential source. I take the omega-3 fatty acids, vitamin D, of course, in the winter. I can't imagine you're not taking that. Omega-3 fatty acids, B-complex. Anyway, I have my own supplement protocol that I've created. And I start my day as I have cubes of ginger in my freezer. So what I do is I take organic ginger and I peel it. It's a little tricky to peel, so be careful you don't cut your fingers. I actually have a glove. Somebody got it for me at a food store, a kitchen store. And it's a little glove you can wear, and when you peel, it protects your hands. So it's really a godsend because I do a lot of peeling. I do a lot of soups and carrots and potatoes and things like this. So I peel the ginger, put it in a food processor like a Vitamix. I cover it about 1/3 with pure lemon juice. Now you can buy organic lemon juice. And then I puree the heck out of it and break up all the strings that are in there. Then I pour it in an ice cube tray and freeze it. So in my freezer right now, I have a bag of ginger cubes. So every morning I take a cube, put it into a cup of hot water, boiling water, and then I add some stevia to it, whip it up. You want to add honey to it, that's your call. And I drink it every day. And I tell you what, it gives you energy. It helps with inflammation. It's an aphrodisiac too, so be careful. I don't want anybody yelling at me for giving you ginger tips. But ginger is just amazing. And so that's really good for inflammation as well. It works differently than other pain relievers that target inflammation. It blocks the formation of certain inflammatory compounds that break down, that exist when there's inflammation, and it prevents them from going on to the next level. Because with pain, it's the pain cascade. One thing triggers another chemical, triggers another chemical, triggers another chemical, and then you feel the pain. So where anti-inflammatories bring down the inflammation, ginger and ibuprofen as well, acetaminophen, can actually block the pain. But we can block the pain, but we also want to get to the cause of the pain as well. And many times the most common cause of pain is a chiropractic issue, a pinched nerve. So again, if you have neck pain, back pain, shoulder pain, stop suffering. Every day, patients come to us and say, Dr. Joe, why didn't I come see you sooner? I have patients cry in my office several times a week. My office is Duluth, Marietta, Stockbridge, and West Cobb. And they cry because they're so upset. They're upset that they suffered for so long and they didn't do this sooner. And it's relatively inexpensive. It's covered by most insurances. It's convenient. We, again, 4 offices. I don't understand why everyone who has pain isn't at least doing a consultation with us to determine if it's a chiropractic case. Most cases they are. And again, we have our medical division. If we have to do injections, if we have to balance hormones, if we have to do medications, we have that division as well. So we have chiropractic and medicine and nutrition and digestive issues, heartburn, acid reflux, burping, gas, bloating. Many times we just need to adjust or pull the stomach away from the diaphragm, and that solves that problem. So again, I don't know how to convince you that you need to take care of yourself, but you do. And in our office, we're really good at doing that for you. We talked about CBD cream. We have a hemp oil as well. The hemp oil is a liquid form. You take about a dropper full every day. Again, it takes time to build up in your body. So it's not like taking medication and it blocks it right away. It takes time. So if you take the CBD oil every day, many times 2-3 weeks, you start to see some long-term effects from it. So that's on the website as well. Dr. Joe's hemp oil, we call it. It's a CBD with hemp oil mixed in. I think it's great. Works well. It doesn't have THC in it. You're not going to get hallucinogenic reactions from it. Don't worry. And then we also have the CBD cream as well, and that should be on the website in the next couple of days. The shipment is on its way, as a matter of fact. Another supplement that's really neat, and in fact, I'm working to formulate this. I talked about this on a show a while ago, and people got real excited about it, so I'll give you a little hint in case you weren't listening. It's a fenugreek. Fenugreek is used in Mediterranean and Asian cookings. It's similar to cloves, and it has a lot of medicinal benefits. When you make a tea out of it, it can actually help women that are breastfeeding produce more milk, which is great. For people experiencing diarrhea, fenugreek is water-soluble fiber, and so you might want to take the whole fenugreek seeds and use that. But the supplement I'm creating is this, and I'm working on it to perfect it before I give it to you. But it's going to be fenugreek, which can actually increase your production of testosterone for men and women. As we get older, our testosterone levels drop, and fenugreek has been shown to help raise that. And in fact, if you watch commercials, there's one with some big old baseball player, and he says, I take this, and, she'll like it too, to help build muscle mass. Well, what it's doing is it's building muscle mass because fenugreek builds up testosterone. Now, it takes about 6 weeks of taking it regularly in order to see the results. So you're not going to take it one day and, whoo-hoo, I'm like a young kid again. But the fenugreek can produce testosterone. But here's the missing link. You need boron in order to activate or free up the testosterone and make it usable. It's called free testosterone. The supplements on the market right now that I see don't have any boron. So ours is going to have boron as well as fenugreek. Then we're going to add some stimulants to it, and we're going to add some other things that'll, maybe nitric oxide or things that have been shown to act as natural aphrodisiacs. So we're putting together this supplement for romance. It's going to be our romance supplement. And again, we're still working on it now. It's not ready yet, but I just want to let you know, we're talking about home remedies. I'm trying to make the home remedies easy as possible for you. That's why we have turmeric on the website. That's why we have vitamin D on the website. That's why we have Super Greens and Essential Source on the website. Again, the minimum supplements you should be taking are Super Greens and Essential Source and vitamin D in the wintertime, especially if it's cold, flu, or COVID season, because the studies, we've covered this many times in the past, vitamin D reduces your risk of getting sick dramatically. If your blood levels are at least 30 nanograms per milliliter, you reduce, several studies show about 50% reduction in getting sick. If you get it up to about 60 nanograms per milliliter, unbelievable. And in England, they're even distributing vitamin D now to high-risk people because they know that vitamin D is a natural way to get the immune system strong. Chances are you've been exposed to COVID at some time in your life. It's around. It's everywhere. And in fact, I saw one study that said if you take a test on anyone and replicate it over 30 times, you're probably going to test positive. And so we might have all been exposed to these things. Why isn't everyone in the world dying? Your immune system. Your immune system is going to be a key player in this. I'm not saying I have a cure for COVID. No, I'm not saying that. But if you listen to our show we did on immunity, drjoe.com, just type in immunity, we give you a lot of tips to help build up your immunity. And so that's why with the supplements that we have on the website, I try to make a lot of these home remedies as easy as possible for you. We put it in a pill form or a capsule form. Real easy. And again, we'll be coming out with a fenugreek supplement pretty soon. In fact, I think the first sample is getting delivered today, as a matter of fact. So we're going to work on that and keep tweaking it. As I do with all our supplements, I try to tweak it and make it work or find the best suppliers that we can to make sure you can trust the product. Because if I'm going to take it, you can feel safe taking it too. Another thing I want you to be aware of is magnesium. Muscle aches, fatigue, migraine headaches, more likely to slip into a numbed emotional state than usual, like you're very emotional, depressed. It might just be something as simple as a magnesium deficiency. Magnesium is often talked about in terms of growth and maintenance of bones, but it's essential for nerve function and muscle function as well. And so many people are magnesium deficient, not because if it's not available in food. It's easily available in food. You're just eating a bad diet. So studies show that almost half the U.S. population doesn't get enough magnesium, and people complain about symptoms. Many times it's a real easy fix. Spinach, almonds, avocados, even dark chocolate is rich in magnesium. If you're going to do dark chocolate, here's the rules. The top joint of your thumb, that's the biggest amount I want you to eat in a day. Organic dark chocolate only. Okay, that's the rules on that. You don't necessarily need to supplement with magnesium as long as you're eating a good diet. When it comes to mood, magnesium can also help. It works on what's called the parasympathetic nervous system. Now, there's two types of nerves in your body. Sympathetic speeds you up, parasympathetic slow you down. This helps relax you. You can get it lentils, beans, chickpeas, tofu, whole grains, bananas. It's pretty easily available. Okay. Another home remedy for headaches and pain oftentimes is romance. Now, keep it clean because I know this is a family show, but you may not necessarily be in the mood for romance, but many times romance will kick in what's called your parasympathetic nervous system and calm you down. So from a pain standpoint, it's all about the nervous system. And so if you have a pinched nerve, it can hurt. However, 90% of your nerves don't feel pain. 90% of your nerves don't feel pain. You can have a pinched nerve and not know it. For example, you don't feel your blood pressure. You don't feel your kidneys. You don't feel your spleen. You don't feel your adrenal glands. All controlled by nerves. So from a chiropractic standpoint, if you have a pinched nerve, sometimes it hurts, but 90% of the time, there is no pain. So in our offices, we evaluate the nerves that feel pain and we evaluate the nerves that don't feel pain. Because our goal is not get you out of pain. Our goal is get you well. If you want to get out of pain, take drugs. Works faster. But there's a lot of side effects and it doesn't get to the cause. We get to the cause of the problem if we can, not just treat the symptoms. So if you have neck pain, back pain, shoulder pain, headaches, numbness, tingling, neuropathy, neuralgia, come see us. In so many cases, it's so easy to fix. And you're aggravated. Patients get aggravated because they didn't come sooner. Why didn't any other doctor say that? I had a patient just earlier today. And what he said to me was, he says, Dr. Joe, he says, your analysis shows that I might be pre-diabetic. Nobody's ever said that to me, but it makes perfect sense. And so we can do blood work on you. We can do pain management. We can do injections. We can do PRP. PRP is we take your own cells, your platelets, concentrate them, and put them back into your own body. So it's your own cells. It's not a foreign chemical. It's not somebody else's cells from some embryo somewhere. It's your own cells to stimulate the natural healing process. Then we had chiropractic. We had nutrition to it. We had supplements. Minimum supplements are what? Dr. Joe's Super Greens and Dr. Joe's Essential Source, and especially in the winter, vitamin D. So we have protocols put together to get you well and keep you well naturally. So if you want to make an appointment to come see us, go to our website, drjoe.com. Right next to my picture, excuse me, it says appointments. Book it there, call us, send us a message through the website. First visit, normally $375. We've reduced that to $199. That's an exam, x-rays, consultation, first adjustment, going over the x-rays on your next visit, and a nutrition evaluation. The nutrition evaluation alone is worth $150. We'll give you nutrition recommendations, supplement recommendations, treatment recommendations. We accept most insurances after the first visit for treatment. And if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. Folks, I'm begging you, even if you don't think you were hurt, come see us. If there's nothing wrong, we'll say, you know what, Garrett, you're fine, go home. We did an evaluation. But if there is something wrong, the quicker you get to it, the better you're going to be. And the supplements are available. You can order them on the website. We'll ship them to you or come pick them up. We would love to have you stop in and say, hi, Marietta, Duluth, Stockbridge, and West Cobb. We have different hours for different offices. If you have any questions, call us. The phone number is right there on the website. You can send us messages through the website. If you have health concerns, health questions, send them through the website. We're more than happy to help. Our goal is to naturally get you well and keep you well without drugs and surgery. If we need drugs and surgery, we have it available. We can certainly refer you out. But we want to get you well and keep you well. So if you want to make an appointment, again, drjoe.com. Make sure you follow us on Facebook, Instagram, and YouTube at Dr. Joe Esposito. We live stream a lot of our shows. You get to see my pretty face. Folks, I'm Dr. Joe Esposito, drjoe.com. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.